So, Dr. Garrett, with all this new equipment which is out there to, help you diagnosing, treating, and all these things, there's one particular machine you have, which is a 3D, a three-dimensional X-ray machine. Tell us why this thing helps your patients a lot.
Well, one of the first things that I'd like to talk about this particular machine is that, for example, the technology has grown the same way phones have grown to where they can do more things. In dentistry, there's so many different things that we can use for technology to help the patient be a bit more comfortable. The most important thing for me is being able to diagnose, being able to detect things sooner rather than later. The difference between a two-dimensional image, before as a dentist, we would put a little film inside the patient's mouth, grab this huge big ray, and it would take a very long time for the x-ray to be taken. It would beep for about a second or two. We'd take that thing out, we'd put it in a little liquid, and we develop it. It'd be this small, and we'd kind of have to look at it and kind of gauge it. Now we went to the digital technology where we use a little plate, a smaller ray, quicker, a tenth of the radiation exposure, which is really helpful. And then that image, we can blow it up and make it really big. Now the next step has been the advent of 3D cone beam technology, where instead of compressing your tooth that is a three-dimensional image into this, now we are able to rotate and take a full x-ray in one swooping pass over from the machine. And a step beyond that is the machine that I have in my office is actually something called green technology. So it actually, from the old machines from 5 years ago, from 10 years ago, my machine emits a fourth of the radiation that those machines used to emit. So the radiation now is very low. The exposure is very, very low compared to what it used to be. I always tell people that the amount of radiation that they're getting from my machine is the equivalent of what they used to get from the old style, old school or old type of x-rays for a very limited number of x-rays on that, which is really great because with that machine, I'm able to find infections sooner rather than later. We're able to see, for implant planning, we're able to see the bone in a three-dimensional image, so we're able to guide, make surgical guides that allow us to have precision, not only to be more precise, but also to cut down on the operating time and to help with the recuperation time. The machine helps a lot with impacted molars or impacted teeth or any type of infection that takes a little bit longer to be able to develop and be seen in conventional x-rays. So this machine, I've worked with it for the last 3 years, and now that I'm at my practice, it was the first piece of equipment that I considered essential in the success of communicating with patients, which is the other nice thing. People walk in through the door and they say, wow, I've never gotten one like this. I've never seen my body in 3D. And we start talking and I start showing them of what's going on in their mouth, and they're able to see all these different things and able to understand them, and they feel so empowered because they're like, oh my God, I saw it. I know I have it. I know I need it. And before, it used to be where, as a dentist, we would look at the little x-ray, look at the different shades of gray and say, oh, wow, this is a cavity, this needs a crown, this needs that. And nowadays, with that technology, it's made it so nicer because people are able to accept treatment that they feel comfortable getting, not because I said it, but because they can physically see it there on the, what a regular tooth in 3D should look like, and right next to their natural tooth. So they're able to get a comparison in their own mouth of what's normal and what's not normal.
Beautiful. Beautiful. So basically it's a show and tell, and of course, most importantly, clinically and scientifically, it measures things, it picks things up, it sees things which haven't been seen before from the dentistry point. So you see things and can fix them, but prevent things before they happen.
Not only the prevention part, because that obviously is the most important factor as a dentist. I'd rather fix something when it's smaller, or catch it when it's not even very big, and explain it to the patient and be something that's fixed very easily and very quickly and very cost effectively. But also it makes it to where the patient sees it, because obviously, if there's a big infection, if the tooth is loose, it's very observable. It's very obvious. And I always tell people, listen, this is what your natural tooth should look like. Does this look like the other teeth? And they're like, no, it doesn't look like it. Okay, can you see this gap? Can you see this dark area around here? Can you see this gap in between your filling? And they start seeing, yeah, I can see that. And before it would be like, okay, there's a little gap right here, and I would be the only one that can see that triangle, and people would be like, okay, I guess I trust my dentist and I'll do it. So it's been really good from an educational standpoint that people can see, you can see and tell, and they can, see it.
Yep. And obviously, so we basically, you see things fast as a dentist, and the patient also sees it. So he kind of like can get a reality on, oh, wow, this is what it is. Because, yeah, very often if we see what's wrong, we have no problem fixing it. If we don't see it, we say, oh, well, it doesn't really hurt. It doesn't do anything.
Exactly.
Let's wait. Let's wait till next time. And next time is like very late down the road.
And that's the sad part. I mean, I tell people, listen, you're seeing it. This is a way we can fix it. If you wait, this is what's going to happen. With an old x-ray, people would be like, it's not hurting. You know what? I don't even want to deal with it right now. But the reason they would say that is because on an x-ray, they wouldn't be able to see the problems that are there. So it would be like, why am I going to fix a tooth that doesn't hurt? It just doesn't make sense. Why would I spend all this money on a tooth that doesn't hurt? Now they see it, and it's like, oh, wow. It creates value in their mind because now they can see it. Now it's there, and it's like, okay, it's there. Obviously, I need to fix it.
And by doing so, they avoid, as I would say, a truckload of problems, right?
Yes, avoiding a lot of problems. That's the main thing, that you're avoiding a lot of problems. It's kind of like when the doctor sends you to get an MRI, a CT scan. They most of the time, a lot of doctors have the availability of taking an X-ray. And if it's inconclusive with what they have, they'll send you, they're like, okay, we have suspicion that there's something there. I just can't see it. I need a more specialized image. You're going to go get this. This is extremely expensive. Those machines are very large. My machine fits in the room about the size of where I am right now. They're very compact because of all the technology and how all these circuits have gotten smaller. This equipment is making dentistry better because we're able to find things sooner. It's exciting times.
Thank you very much. Thank you very much, Dr. Garate. Thank you very much.
Thank you.